No friends, no fun. The pandemic, the lockdown, it's all surreal. Social distancing is tricky with kids, especially the tiny ones. Some countries like Spain have prohibited youngsters from leaving their four walls.
I want this quarantine to be over, so I can go back to school with my friends and go out again.
For some time, scientists warned children who catch the virus do not show symptoms but can infect others. Now, a Swiss study suggests anybody under 10 cannot contract the coronavirus at all. Fact or fiction? As some schools start to reopen, what role do children play in the pandemic? Now, these are trying times for parents. Are kids safe from the virus or are they at risk? According to experts, the jury is still out.
Music to the ears of parents, schools and kindergartens. This week, the Swiss Health Ministry said children under the age of 10 are not at risk of COVID-19 as they don't appear to contract the virus. The announcement was based on conversations with doctors and a study allegedly showing children don't have the receptors to get infected with the virus. One study in Iceland interviewed a group of voluntary participants and came to the conclusion that children play only a minor role in spreading the coronavirus. German virologists, however, have questioned that, saying the research only focused on a small fraction of the population. New research from Berlin's Charité Hospital involving now famous German virologist Christian Drosten suggests children develop as many viruses in their throats as adults, making them just as infectious. And researchers involved in a Chinese study concluded children become infected with the virus just as often as adults. One thing experts around the world broadly agree upon is that infected children tend to develop milder symptoms than adults. But as doctors point out, that's not the case for every single child.
There are some children who have developed severe disease and some children who have died. There are some recent rare descriptions of children in some European countries that have had this inflammatory syndrome, which is similar to the Kawasaki syndrome, but it seems to be very rare.
The World Health Organization is appealing to doctors to systematically record information on child cases of COVID-19. An extensive international database would make it easier to determine how the virus affects children. And that in turn could allow schools and kindergartens to be able to reopen their doors with confidence.
For more, I'm joined by Professor Markus Mall, Pediatric Director at Berlin's Charité University Hospital. Good to have you with us. Now, there's so many different studies out there. Some saying kids are safe from corona, others saying they're super spreaders, and others again say that they get seriously ill too. How much do we really know about COVID-19 and kids?
Yes, hello. That's a good question. So I think what we can clearly say is that worldwide, few children have been reported with disease caused by the new coronavirus compared to adults. And mostly in the community, these kids are, largely asymptomatic or present with signs of a common cold. When they are admitted to the hospital, they generally present with milder disease manifestations in adults. And remarkably, that means that we are not seeing the severe pneumonias and respiratory failure that have been observed in adults, especially in the elderly, critically ill population.
Now, given, as you say, that kids often show asymptomatic symptoms and that's difficult with people in general, how can parents know that their kid's actually infected?
That's a very difficult question. So, again, the signs in children are often very similar to if they get symptomatic, very similar to a common cold. We are just getting out of the cold season. So, until a couple of weeks ago, we had a lot of children in Germany with, running fevers for a couple of days, runny nose, sore throats, and bronchitis. So, to really know if this is caused by an infection with the new coronavirus, The only way to really find out is to perform diagnostic testing in a throat swab.
All right. And are there any differences in the way that children react to the coronavirus when it comes to different age groups? Are babies differently affected than toddlers or school kids?
Yeah, there are some I've seen some reports from China indicating that newborns, especially, may be a little bit more often affected more severely by requiring also oxygen therapy for some time. In a survey we are doing in Germany at the moment, we are actually not seeing that. It's the disease severity we are seeing is pretty commonly spread across all age groups, meaning infants, preschool children, and then also the school age and adolescents.
Now,
and the again,
yeah. You go.
Yeah, and again, the most. And again, the most, of the symptomatic, the most common symptoms we are observing here is fever, rhinitis, sore throat. So again, very, large overlap with common cold or respiratory tract infections, and about 10 to 15% also associated with bronchitis and pneumonia, as well as gastroenteritis. So all these symptoms we also see with infections with other respiratory viruses we are familiar with in pediatrics, for example, the RS virus, influenza, adenovirus. I think what is also remarkable is that in the children that are that are affected by the new coronavirus, these symptoms tend to be less severe than what we observe with some of the other viruses in a general,
right.
infective season.
But kids can get ill and they can spread the virus. However, we can't keep children locked up indefinitely to keep them or us safe. So briefly, what should parents do?
Yes, so that's another very difficult and tough question, and also one where several studies have started, also regarding the question, how, what role do children really play in spreading the virus? There are reports that they can spread the virus. However, if you look at the absolute numbers of infected children, again, it's been much smaller than adults. And there also have been, at least in Europe, very few reports where it was shown that there was a transmission from a child to a parent or another child. And typically it is the other way around, that adults infect their children.
All right, Professor Markus Mahl there from Berlin's Charité University Hospital. Thank you so much for your time today.
Thank you.
So maybe kids are better off at school after all. So many questions, and there are many, many more. Who belongs to the coronavirus risk group, and how can we minimize potential damage to our organs? It's time for our science editor, Derek Williams.
Does having an autoimmune disease like type 1 diabetes increase your risk if you catch COVID-19?
Diabetes is one of the comorbidities that puts you more at risk of a severe outcome if you catch COVID-19. And as far as I could discover, that's regardless of whether it's type 1 or type 2. We aren't certain why, but there's speculation that the virus might thrive in an environment where blood sugar levels regularly spike. And doctors are saying that severe outcomes could also be more likely in people with other autoimmune disorders, especially if they're taking medications to help them suppress their underlying condition, because that can cause them to be what's called immunocompromised. In a nutshell, if you take medication to suppress an autoimmune disease, it could also cause your immune system to be less effective at fighting off a potential infection with COVID-19. So if you are taking medication that does that, the recommendation is not to stop without consulting your doctor, but to really take as many precautions as you can to avoid exposure to SARS-CoV-2.
Is it possible to block the immune system so people with COVID-19 don't get lung damage?
A big cause of mortality in this pandemic is not the infection with the virus itself, but the body's own immune reaction to it, which can spiral out of control. Part of any immune response to a pathogen is the release of compounds called cytokines, which cause inflammation and attack infected cells. In some patients, this curative measure doesn't shut off after the virus is beaten, but begins to turn on the lungs and other organs, destroying tissue and generally wreaking havoc. This overreaction can be blocked by immunosuppressive drugs, like those that are used to treat rheumatism or other autoimmune diseases. But employing them is tricky. If you block the immune response too soon, the body can't wipe out the infection. But if you leave it too late, the damage is already done. So it's a pretty delicate balancing act.
I survived tuberculosis not long ago. Am I immune to COVID-19 or more susceptible to it?
The answer to the first part of your question is no. Having tuberculosis will not keep you from catching COVID-19. Although both diseases affect the lungs, TB is caused by a bacteria and COVID-19 is caused by a virus. The immune response that's developed for one will not protect you from the other. As to whether you're more susceptible to COVID-19 because you've had TB, this is something we still don't really know yet, but experts like those at the WHO are going under the working assumption that people who get both will generally have poorer outcomes. What's almost certain is that ruptured supply chains in the pharmaceutical industry and the diversion of resources away from TB will put many people, especially in the developing world, at even more risk of dying from it if they catch it. Tuberculosis already kills over 1 million people a year, and the COVID-19 pandemic will very likely cause that number to rise.
Finally, one of the world's oldest amusement parks is doing its bit to get kids through the coronavirus crisis. Tivoli Gardens in Copenhagen is opening its gates to kindergarten children for free. Operators of the park say they have a lot of space to offer for social distancing and lots of fresh air. For kids, of course, who've been cooped up at home in isolation.